Hello, everybody. Sorry, I got stuck in traffic, but I'm here now.
Okay, good. I think we'll be a small but enthusiastic group. That is the goal of today. So Lara and I put this session together because we did as part of the pregnancy and postpartum focus groups with Tech4Eva. We had a discussion around sort of the patient journey. We looked at selling femtech, and the question that came up, can we have some practice in actually pitching? And that happens a lot. People, there are lots of pitching sessions you can go to and things like that. But I think you can never have enough. And I think it's good to have different types of feedback as well. So I think hopefully the goal of today is to let you see how others think about it, and you actually give some feedback to each other, which I think is always useful. So to sort of critically think about what did they do and what did I learn from what they did. So that's the goal. To get to know each other, we're going to do a short icebreaker, which I've already warned you about. After newsletters, we would like to ask you to do a brief introduction with your name, your company, whether you're a startup or you're and want to pitch today, or if you're someone else, and what your role is in the community if you're not a startup wanting to pitch. We will start with the people on my screen, and I'll call out names randomly. If you would also like to share your contact details in the chat, then please do so as well. But we'll start with Diana. And and name, startup, and then also your favorite salesperson.
Hello, everybody. I hope you can hear me well. Very nice to meet you all. So it's my first time here, and I am a female computer scientist, PhD in medical image analysis, so computer science for health. And I am currently looking for angel investments, and so I thought I actually saw your website and I signed up for the newsletter, and then I saw so it's a good newsletter. I'm reading it, and I also recently I had a baby, so I'm maybe a good potential reviewer of the pitches, I thought. And so I think that's about me. If you have any questions, please, you can contact me. I can leave my details here as well. So my favorite salesperson is Jada, because I am, as I mentioned, I'm a computer scientist, but I moved into commercial 6 years ago in a startup. And it was very difficult to move from being a PhD academic person to actually selling and talking about money, and not being sort of like selling a phone. And she was extremely helpful and always fun to work with, and extremely passionate and empathetic salesperson.
Okay, great. Sven, you're next on my list.
Hello, very glad to be there again. Thank you very much for the organization. Sven, co-founder of Dana. Dana is a digital assistant to improve the mental health of women during motherhood. My favorite salesperson is Gandhi. It's a very long sales process with a lot of different stakeholders, and he was consistent for years. So I think that the non-violent sales process is quite astonishing. And I'm here because I'm looking for a lot of red flags. So we know that there is a need, but there is a little problem on who can pay for the solutions. I'm waiting forward to hear all your thoughts about what you don't understand and what you would like to have in that pitch. Thank you.
Senya?
I just shared in the chat my contact details, so you have them already. My name is Ksenia Tugay. I am working at Groupe Mutuel, which is the founding partner of Tech4Eva program. I'm in the innovation team. In terms of my background, I have a PhD in biology. Yeah, really happy to be here. I've been working with startups since 2014. So listened to a lot of pitches and helped quite a few people. Also did a little bit of coaching. And my favorite salesperson, well, yesterday I was in Montana for the whole day for a small VIP conference on digital trust and all the digital education, all the tendencies there. So I would have to say that it's Gary Vaynerchuk, so Gary V, because I think he's a very cool. He knows these hype areas when they're just starting to become hype, and he's extremely good at leveraging them and creating new business opportunities. The last thing that he's doing, which I think is pretty cool, is everything with non-fungible tokens and using them for selling art, for example. So I don't know if you don't know him, I can share the link as well.
Yeah, please do so.
How you cannot know him?
My non-fungible token collection is very small. Next person on my list is Sali.
Hi, good evening. My name is Sali Knani from Kamel Diagnostics, an Israeli company, startup, mainly like many others looking for investment or partners. Our lead product is embryo selection for IVF process, and we base our system on a biomarker, which is oxidative stress. Now, oxidative stress has many other potential applications, and I'll focus in my 5 minutes on what we have done and what we plan to do for other applications in the women's health arena. Okay, please wait for that. That's it. Thanks.
Do you have a favorite salesperson or?
I'm not sure. Let's skip that. Okay. I didn't think deep enough about it. So.
All right. Okay, Alice Matton.
Hi, so I'm Alice, and I'm running a startup called Pharmista Technologies, where we are developing a reusable pregnancy test. I'm also based in Sweden, but currently I'm in Spain, which is why I'm outside right now. And what else? Was it my favorite salesperson?
Yeah.
Question. Yeah. So I would say Barack Obama, maybe. I think he's really good in getting people enthusiastic about his ideas and his vision for the future. So yeah, I would go with him.
Okay, great. Joanne?
Hi, nice to meet you all. My name is Joanna, and I stepped in for my teammate very shortly, and we are working on an idea surrounding nutrition during pregnancy. We're currently in an incubator program in Germany, and we're interested to get in touch with the community and hear about other ideas around pregnancy.
Great. Anna Gavin?
Hi, I'm Anna. I'm co-founder and CEO of Join Mamas. Join Mamas is a social app connecting mothers based on the location, on their interests, and the age of their children. And we help mothers to overcome the postpartum depression, because after they have a child, their social life goes down, as they don't have enough communities and don't have enough peer support from other moms. And we help them to create like meaningful meetups to come together and in a group that communicate, chat, or meet and help each other with like all the things, starting from emotional things, and so it can also go just for something like doing together. I'm here, I think, 5th time already in this session, so I'm kind of like a permanent visitor. And I'm looking mostly for B2B partnerships with bigger companies who would like to support this community building process. And I would say that my favorite salesperson is Ray Kroc from the Founder movie. If you haven't watched it, I just recommend to watch. And he one of the co-founders of McDonald's. What I like about him is how passionate he was about the product, and that he changed the business model and he found the product market fit. Because without him, nobody would know anything about McDonald's. It would be just one cafe in the US. Now it's like a worldwide business.
Right. Thanks, Anna. Virginia.
Hello, everyone. Nice to meet some of you. I think I don't know everybody here in the room. My name is Virginia Franco. I'm CEO and co-founder of the company Yoni Solutions. We currently work with vaginal microbiome analysis to improve fertility treatments in women under reproductive treatments to find the potential causes of in vitro fertilization failure. And so we are with a academic partner here in Switzerland, pathway, the regulation of the product and the technology. And I'm also, sorry, I forgot to mention that I'm also obstetric and gynecologist. And I'm happy to listen and excited to listen the ideas here in this exciting group. So thank you very much.
Right. I'll go and then I'll hand over to Laura, who will then take over. So Doug Hagstrom is my name. Together with Laura, I host these focus groups. I have a day job at the University of Basel Innovation Office, but have been helping building healthcare innovation ecosystems for the last couple of years. And before that, I was a chemist and consultant and bits and pieces. In terms of favorite salespeople, it's actually one of our partners who is working with a large pharmaceutical company, and he sells all sorts of stuff to the company and supports our programs. And he's able to sell the vision, even if he doesn't understand the vision. He somehow still comes back with money and support. So I think the person who can sell a vision and get people excited is my favorite salesperson. Laura, I'll hand over to you.
So hello, everybody. My name is Laura Rio. I have a background in medical biology, and for the last 6 years, I've been working in the field of neonatology and pregnancy and everything that has to do with innovation in these fields. So I'm very excited to hear more about all of your companies. I'm a co-host here at the Tech4Eva Focus Pregnancy Groups. And my favorite salesperson, so I don't have one, but I'm very much intrigued by the strategy of the luxury houses such as Hermes, Chanel, who made people give so much money for something that it's not worth it. So I'm very much intrigued by their mechanism. So I don't know much about that. Maybe some of you that are more into economy could explain how it works. So yes.
All right. Great. Yeah. So Laura, do you want to give a presentation, or should we just, before we get started, hands up the people who would like to pitch? We've got your answers from the survey, but I just wanted to just check that there's no one who wants to pitch that didn't say yes before, or if there's someone who's suddenly got cold feet and we have to convince to continue.
Well, as I said, I'm ready. Just tell me when.
Perfect.
That's the attitude. Ali's ready.
Am I the only one?
No.
No.
So Diana, you're interested?
Yes.
Sven, yes. So thumbs up, everyone who's interested. And actually, picturing Alice, that was very enthusiastic. I think you can do more selling of the vision from you. And okay, great. Then Laura, do you want to give an intro for people?
So I have prepared just one slide for the pitching session. Did you already ask, I don't know, since I was a bit late, if everybody was okay to be in record?
Yes.
Everybody? Okay,
No problem.
perfect. So I tried to share my screen. Okay.
Sharing the other screen. Yeah.
Can you see my screen now?
Yes.
Okay, perfect. So it's a very, very small presentation. It was just a bit the rules of the pitching today. So as Julie sent to you by email, you have 5 minutes to pitch. Those who are brave enough to pitch today, thank you. And the other participants can choose different hats. So the aim is really to give feedback about the presentation, so the form of the presentation and of course the content. So we need someone who will say what was good, that will have the green hat, someone who will say what was not so good, can be the orange hat, somebody who can maybe find ideas for improvements would be the blue hat, and another brave person who will pitch back. So who will have 1 minute to pitch back the 5-minute pitch. So to see what was the main points that were salient in the 5-minute pitch. So I think we can, at each person who will pitch, we can designate these hats, or you can self-designate yourself for these hats.
I have a question.
Yeah.
Will be designated before?
Yes. So,
okay.
Yes.
Just to avoid a surprise here. Thank you.
Yes, yes. You don't need to have all the hats, otherwise it's too complicated. So is that okay for you?
Can we add an invisible hat? If you know anyone that can help the startup, you can send messages and directly afterwards.
Yes.
Sure. Of course.
Sure. If you,
Yeah, can I just ask every participant, guys, before you start, because you all have different aims, as I understood. Some are looking for money, some are looking for B2B partnerships. If you can just remind us who is this pitch for? Because it's not going to be the same pitch for B2B partnerships and for ask of 1.5 million Swiss francs. Yeah. Thank you.
Yeah.
Exactly. So I think let's start with Diana. Are you ready to go? And the person to give the 1 minute pitch back is Alice. Who would like to who would like to be positive? 2 people?
I can be
Just
positive.
a second. I'm not pitching anything.
Okay, so who are the pitches? Sorry. Just to be clear on that one. We have Sven from Dana. We have Sally, Alice. So it's just those 3, is that right? Okay, if anyone changes their mind and gets excited, then you're more than welcome to join. Then I think what do you think? We start with Sally, who was so enthusiastic before. Alice, ready to pitch back for 1 minute. Virginia was positive. Who else would like to give positive feedback? Laura as well. Negative feedback, I'll just assign Joanna and Anna. And Sven and Senya, you're to think of improvements. So, Sally, are you ready to share your screen and do your pitch? I will be timekeeper.
Just a second, please. Just wanted to share screen. Can you see it now?
No.
Can you see the screen?
No.
Oh, just give me it. Sorry. Where are we? Okay, good.
Yes.
Okay.
Okay, so Sally, your audience is who?
Okay.
Who is your target audience?
Well, again, the audience are either investors, which I don't see in the audience now, but maybe it will spread out later on, or potential partners for the co-development or things like that. Basically, it's not a sale or potential distributors, if any. But again, I see here mainly partners with the same position. So again, I'll base what we have on our system, which is called Fortissimo, or the current generation we call it Fortissimo AI. When we want to plan to add artificial intelligence qualities to the system, the idea of the system.
Sally?
Yes.
We'll start the pitch timer now. You have 5 minutes. I will flash.
Okay.
A little.
As I mentioned, our system, our lead application is embryo selection for IVF process. I'll start with the 2 minutes pitching, which is already prepared, and then I'll add a few words about the other applications we plan to do.
Right. There's no sound there. You'll have to. There is no sound.
There's no sound?
Do the playback. You have to talk.
What about now?
No. You have to go into share screen, advanced, and then share sound.
Just a second. You said to share screen again?
Yeah, so stop the share. Start the share screen again.
Stop share. Okay.
Start the share screen and click on share sound.
Share sound. Where's that? Sorry. I don't see it. I have the share screen.
Bottom left of the when you choose
share sound. Sorry.
One of 6 or 7 couples in the fertility age suffer for infertility. For each one of them, this is the whole world, and they will do everything in order to have a baby. Can you imagine a solution that will help these people bring a baby home? There is a solution, IVF, in vitro fertilization, which brought millions of babies so far. However, the success rate is very poor. Here we come. I'm Tzalik Narni, the CEO of Carmel Diagnostics, a company specialized in the IVF sector. We have developed and patented a system that substantially improves the success rate of the IVF process. Saving money to the healthcare system, shorten the time, pain, and cost to achieve pregnancy, and help the couples bringing a baby. By providing clinics with efficient embryo selection using oxidative stress as a biomarker. This non-invasive technology is innovative and disruptive in comparison to the state-of-the-art morphology. We conducted successful clinical studies testing hundreds of embryos, and the results have been published in leading magazines and in professional trade shows. We have an addressable market of $500 million through our pay-per-test business model. We have a dedicated, experienced team, and among our advisory board, there is a Nobel laureate. Our goal is to become the new standard of embryo viability assessment and get 10% of the world market in the 5th year of sales. Thus, we are looking for an investment of $4 million with an ROI of 3 years. We invite you to talk to us and meet us to have more details of our plans and explore this great opportunity.
Sorry. Okay, as I mentioned, we have developed the system. It's up and running. It's working. We didn't sell so far, but we've made many clinical studies, clinical validation studies. We base our system on oxidative stress as a new biomarker. Very important to mention, the system is completely non-invasive, and it's AI-driven, and we plan to, once we start using it in the field, to have continuous improvement of our scoring algorithm. Okay, the system, as I mentioned, is a platform. The technology and system is a platform. We can test every body fluid or biological fluid without the need of recalibration. I want to focus on the women's health applications. The embryo selection is already available. The other one is early alert of preeclampsia, which is, clearly connected to pregnancy, to our subject today, okay? And where we had a successful pilot. And the next one in the pipeline is diagnosis of endometriosis. Again, we are still in the fertility world, women's health. I just show here the connection. As I mentioned, with preeclampsia, we already had an initial study, and you see there are over 600 data pages that show the connection. With endometriosis, it's more or less the same. It has endorsement from the medical science, and it's very much needed application. And again, this is our ultimate goal. So I finish here, and we all want to get that cute baby, and that's why we are all working on that. Thank you.
All right. Thank you, Stalin. Should we start with the positive people?
Yes, I can start.
Yes.
So I like that he supported his technology, saying that it had been used in clinical trials. That's reassuring. It will be interesting to have a glimpse of the results, however. And in the last slide, I thought that the sentence, the small slogan that you have, it's also very catchy. So that would be the two main positive notes that I noticed.
I am the second one that make the positive comments. Is that
a question?
Yes.
Yes, that's a question.
Yes.
So if I understood correctly, your technology will give opportunity to select the embryos without biopsy because it's a non-invasive test. Did I understand it correct?
Yeah, it's completely non-invasive. We test the medium in which the embryo is incubated. We don't touch the embryo.
Yes, so the positive feedback that I have in this field is you don't rely on biopsy. So I mentioned as a less invasive test, positive point, does not rely on biopsy. You have the opportunity to select, to improve the embryo selection process, which in a long term, after the studies that you are probably developing, you select better the embryos with decreasing the chances of failure on the in vitro fertilization and decreasing the cost for women, decreasing the stress, decreasing the timing, etc., everything that goes together. Avoid complication on pregnancy in long term, avoid postpartum death, avoid neonatology complication. It's in long term, but you can reach there with the time. And decreased miscarriage by repetition, etc., etc. This is the positive comments.
Okay. There's two sort of things when we think about the feedback. It's sort of the solution itself, but today's really a focus on also thinking about how the pitch is put together. What's the message? Can you get the message and things? What was not so good about the pitch? from the people who were to be negative?
I think I can try to give negative feedback. So I'm not so much involved in this topic because I'm more in business development and software development. But what I can see in general from the pitch, maybe I would like to see a little bit more like competition. How are you different from your competitors? To understand what is clearly innovative and like what will be in demand. I would like to see business model. How are you going to sell it? And also you mentioned you have like 3 different directions already. So which one you are focusing on now? So I would pick up one, because if you go to all 3 directions, like you choose, you lose the focus. So maybe I would like pitch only one of them. So it's like my feedback, but again, I'm not so much in like medical topic, more on business side.
And I'll add to Anna, Sally, very good. I really liked it. Maybe to improvement, too many different ideas. Maybe I would work some layout of the slides, because some slides are very nice and some are very simple. I wouldn't put a video, because it's exactly what happened is we had technical problem at the beginning and we want to hear you and we're not interested in the video. Again, I don't think it was, it's interesting to make so many ideas. Just explain one and why I should be interested to invest in you for this idea.
Can I answer in a couple of sentences?
So this is another rule I forgot to mention at the beginning is you should thank people for the gift of feedback. And that's it.
In the chat. It's okay.
Can I give some feedback without having a hat?
Sure. Didn't you get a hat?
No.
Oh well.
But it's okay. So maybe as a background, for 6 years I listened to biotech pitches, and I quite liked your pitch. And I have to disagree with some of the negative feedback that was mentioned in other diseases, because it's quite popular in biotech to see this is our path in this disease, this is our path in diseases, and this is how we are thinking about deploying our technology in all of them. So I quite like that. I would keep it.
And that is an example of the gift of feedback, which is also that as leaders, you have to make a choice. You know, do I listen to the people who say simplify, 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 or do I, keep the complicated story? And I think I'm certainly on the side of simplify on that one. But I think these are legitimate choices, and you all need to make those choices amongst all the people. Joanna, do you or your colleague have any thoughts?
Yes, I do. I have thoughts from the medical perspective. I'm a medical doctor, and first thing I want to say, maybe this is due to my bad internet connection, but the time that the slides showed up was very short. I did not get the chance to read them. And then you were again seen on the screen talking through the presentation. I think the time was a little short to read the slides. Then I really would have liked to see a patient journey. How is the state right now? What do patients face in the current medical system when they want to get pregnant? What are the difficulties and problems? And also, I would have liked some more specific information on what is the current gold standard and what is the success rate compared to what your product can offer. Also, on the point when you showed the studies on Google Scholar, I would have preferred to show the studies on PubMed or another database like PubMed and not on Google Scholar. Yeah, so that's mainly it.
Two questions on my side. Who is the cutie? And the second question, why you didn't show your own publications? Because I think you did some, didn't you mention that you did some publications? If you have some studies already, I would do,
Yeah.
I would show them. And I also, maybe I missed it, but I didn't understand anything about FDA, MDR, any regulatory certifications that you might have. Yeah, that's my feedback, I would say.
I'm not allowed to answer. I'll do it in the chat.
Thank you.
We have CE mark and some others.
Okay, cool.
Can I add to that again? I think this would really be great to show your own publications. And also, you said that you published it in a leading magazine. I would be interested what magazine that is and what the impact factor is, maybe. And also, you said that it's already patented. And so a patent would be a really good asset. So I would have wished you would elaborate on this or stress this a little bit more.
Well, it's Fertility and Sterility, which is #1 magazine in the fertility area. Patent is underway. I mean, submitted, and we are in the national phase. And again, I had just 5 minutes, so with that, I couldn't do competition, publication, business model, and others. I'll be happy to share more information with everybody. I put my mail address, and just one last sentence. I wanted to connect it with pregnancy, not just fertility or so, even though IVF leads to pregnancy. And that's why I added the 2 pipeline applications. We definitely focus on the embryo selection. This is what we have. This is what we offer, and the rest is just for the future.
Does anyone think it was a good idea to show the video?
No.
Well, because I think...
Yeah, I understand where this video comes from. It was probably some sort of conference where this video was required to do a video pitch, but I would not recycle it.
Okay.
Yeah, I think it's about, I think what people are sort of, the feedback people, like, people want to connect with you. They want to trust you. So they want to hear about your, the publications, regulatory, all that's about trust. And then they want to be sold on something. And that's what I think the simplicity comes from. Any other feedback before we hear what how Alice would summarize the pitch in 60 seconds or less? All right, Alice.
Hey, so
just give me a moment and I will put on a timer for 1 minute. And you can stop earlier if you like, but just I'll just start my timer. Okay.
So
please,
from what I could understand, it's all about IVF treatment, where you have developed and patented an IVF process that will shorten time and decrease costs for both patients and the healthcare system. You're focused around embryo selection using oxidative stress as a new biomarker, which is innovative and new. It's non-invasive and AI-driven, and clinical studies has shown very positive results of your technology. It's a $500 million market where you expect to gain a 10% share within 6 years, and you ask for $4 million in investments. Furthermore, there are 3 potential areas which you could use your technology in, which you didn't really go into depth with, but just kind of laid out there that it's possible to use this as a platform technology.
Excellent.
All right, exactly 1 minute.
Yes,
Perfect.
definitely.
Well done. Sally, what did you think of that message? Did Alice capture your messages?
But she did it, as I said, it's excellent. I mean, she did it in 1 minute. I can do it in 20 minutes and answer all the questions that people ask here. But she took the main points put them together continuously, I mean, in a very good way.
Thank you.
So maybe I delivered the message, but it's okay.
Yeah, exactly. You did. So I could understand the main points of it, but I also understand the feedback of kind of narrowing everything down so that it's very clear on these points: the market size, what is your product, what's your patent, you know, everything. So it's super clearly communicated.
I think that was a fantastic pitch, Alice. I think you did a great job of distilling that down. We will give you a break, Alice, and I think Sven, is there someone who would like the challenge of the 1 minute pitch? And let me back. Diana, how do you feel about that?
Yeah, happy to do that. Nope. Can you hear me?
Yes, I think Doug is frozen.
Oh, it's not me.
No. So you'll do it.
Yeah, happy. Looking forward.
Okay, who wants to give positive feedback?
Who or which one is pitching now? Is it me or is it someone else?
It's Sven. Sven is pitching.
Sven. Okay, I can do positive feedback.
I can do it too.
Okay, perfect.
You need one or two?
Two, it's fine.
Okay, so I pick the second.
Anna, would you like to give negative feedback? It's fine. you can change for the next round.
Yeah, I will, but this time negative then. Okay.
Joanna, second negative feedback. And Virginia, you can propose inventive new ideas for the pitch.
Okay.
Is there someone who is not having any hat?
Me, but it's okay.
Oh, you can suggest new ideas too.
Okay, good.
Great. So I will set up a timer. I think we lost Doug.
Maybe I'll just set the stage. I'll set the stage before. So Barcelona Health Summit, we're talking to doctors, pediatricians, investors. It's a contest. And basically, there's a lot of sleepy people in the public. That's where we are. It's dark and it's huge. And the screen behind me is enormous. And let's go.
So you have to wake people up.
Yeah, I have to.
Okay.
And I go here.
Okay, I'll start when you're ready.
And this is Maria. Maria can be you, your wife, your sister, your daughter or friend. As a woman, Maria should be happy to become a mother. But is she really? And does it matter? To find it out, we mapped her appointment with the healthcare system during matrescence journey. Matrescence is a massive mental, physical, and social transformation of a woman who is becoming a mother and lasts around 4 years. In theory, there are 60 visits with 7 healthcare professionals. Now, investigations show that Maria has on average less visits than thoughts. In most of the case, she never comes in contact with a mental health specialist. And this explains the hard truth of motherhood. There's a 90% possibility for women to experience some kind of mood disorder during motherhood, and up to 25% possibility to suffer severe mental health pathology. But we will never know who is affected. 75% go underdiagnosed, and we won't be able to help. Mood disorders and mental health pathologies during motherhood have a direct impact on the mother's health and her capacity to take care of her child, with potential long-term effects for her and her baby. That's why we developed Dana. Dana is a digital health and well-being solution for women transitioning into motherhood. On one hand, Dana is a digital assistant designed to inform and empower the woman during her complete matrescence journey, including features designed to answer her pains and needs. On the other, Dana is a software as a medical device and a digital therapeutics tool for the healthcare system. Our IP is the Motherhood Vitality Index, measuring the mental and well-being experience of the woman, and is developed with top universities and hospitals of reference. Our data architecture for the early detection, diagnosis, and monitoring of mental health disorders is built to be scalable from the beginning. We launched our first MVP beginning of 2021, created 30 psychoeducational programs, and tested them with users with a 70% efficacy. Second MVP released in September to validate the product market fit and start with the first level of artificial intelligence. Next year, we will build a medical device and conclude the first pilot and work on the clinical studies. Long-term objective, achieve the medical device and digital therapeutic certification as a new income stream for Dana. We are starting with online therapy to capture user data and will distribute it through a B2B2C channel with a revenue share and a healthcare motherhood professionals. In a further step, we will evolve to a B2B solution with the software as a medical device for the private healthcare system. There's a lot of mental health tech companies out there, but none focusing on motherhood, and a lot of well-being apps, none reaching medical device standards. This leaves a space to innovate and take a few years in advance. Dana starts in Spain, impacting 2 million women to prove the scalable business opportunity. And next step, expand to Europe, US, and LATAM with €1 billion revenue potential. Veronica and myself launched digital venture in the past and had the opportunity to lead international companies in different countries. Our motivation to launch Dana lies in our own personal experience. Veronica tried several years to become a mother without success, and I was not able to support my wife's mental state during motherhood. Dana is backed with senior profiles in artificial intelligence, big data, behavior science, perinatal psychology, and mobile and product development. We started Dana with a senior pediatrician and senior midwife, and then gathered other motherhood specialists, friends, and family to achieve €75,000 in our first round. And we are now looking for 250,000 more to accelerate the product market fit phase as a bridge to the seed round planned for April 2022. Let us fight mood disorders and mental health pathologies during motherhood and cut the underdiagnosis ratios by half in 4 years. We can then offer a monitoring tool to the healthcare professional and hospitals to improve the patient's journey. The market potential is huge, and with your help, we can offer a path to better health to millions of women, their children, and their families. Don't know about the time, but it should be 5 minutes, more or less.
Now you have 1 minute left.
Okay. Do you want me to talk more? No,
but you can go slower when you present. You're going very fast.
I'm sorry. I thought it was too. Yeah.
It's very the suggestions of Ksenia.
It's very sorry, Laura. It's very good. Yeah, you can go slower because you were really going fast. It's not clear to me. You're presenting at a medical conference. You're asking them for money, or what? Like what?
No, it's a medical conference with a pediatrician, and you have also investors, and it's so it's visibility. And you're talking with VCs, but the organization is a medical association.
And you're only going for 250K? You don't want to ask for more money?
It's pre-seed. We don't have the traction metrics.
Okay.
We would.
Improvements. Yeah. Speak slower. That's pretty much it. Actually, it's a very, very, very good pitch, and I was surprised that such a good pitch for such little money.
So talk slower and ask for more money.
Yeah.
Okay. So who had the positive feedback?
I'll do it. I think the good part here, or the good points, are covering the whole scope of what's done, from the problem to the cure, to what you are doing, to the business model, and all these aspects. Again, I join the comment of the speed. Sometimes you can't get it when it's so. But I see, I take part in many presentations. Sometimes they give you 60 seconds, 2 minutes, 5 minutes, 8, 20, etc. And when you are with the 5 minutes, that you try to get everything. And again, you mentioned that you got €75,000 only so far. I guess the rest of it is what's called sweat investment. I mean, you invested your time and your partner's time, because 75,000 is very little. And well, I wish you good luck. Just if you can leave your mail address, because in the past I had a project of trying to identify mental disorders or mental problems using HRV. So I don't know if you are familiar with that. It's an interesting issue.
Thank you.
Okay, thank you. The other one with the blue hat.
Yeah, that was me. I really thought that it was very clear. And I also liked the fact that you had more slides but less info on them, because sometimes when you show slides with a lot of info, it's hard to know where you're at in the pitch. But I think you really did that in a really good way. And it also makes it intriguing all the time, because you're constantly like moving to the next point and the next aspect of your business. So yeah, I really liked it.
Thank you.
Thank you. So now the negative feedback.
So I'm on the negative side again. It's very hard to give negative feedback, because really the presentation was very clear, very professional. Everything is covered, like roadmap, business model, even the cost of the app, and so on. So actually, I don't have much negative feedback, because it's all understandable. I would really recommend to go to American market, because our app is growing organically in the US market already. And I think for your app, it will be the same, even without a lot of marketing activities. So I would really encourage you to try, like make a small try, even without big budget, but I think it will work out well, like based on my experience at least. And you mentioned that you have no traction yet. It was not clear from the presentation, but all the other things are like perfectly covered.
Thank you.
Okay, thank you.
I think I also had the negative feedback head again. So it's really hard to give negative feedback. But what I can say is that it needs to be a lot slower, that was said before. And maybe then there could be something found on the slides to give negative feedback on. But for now, I really can't. I just wished you had elaborated on this motherhood score a little bit more. This was too fast for me. I don't know what this score does for you. So yeah, that's all.
It's marvelous. You can all invest 5,000 euros in the company then, if you all enjoyed it. Maybe.
Have you looked at any crowdfunding things?
Yeah, but the crowdfunding will only work if we have already traction, and you need money for the crowdfunding. So if you want 100,000, you need 60,000 to show that people want to invest in their own crowdfunding platform. Mm-hmm. So it's a bit tricky, but it's a plan for next year, February. Yeah.
All right. Improvements was, I think, the next one.
I think it's me.
Yeah.
Yes. And so congratulations for your presentation. I think that improvements goes a little bit with what the girl said about, for example, it already happened to me as well. When people say, oh, you speak it too fast, maybe for the next presentation, remove a little bit of information from the slides. If the slides get too much information, it obliges you to speak faster, and it's not a good idea. So remove a little bit of information from the slides. And if it has too much information, generally people stop paying attention. It's automatic, like, oh, it's too much information, they kind of avoid. And in order not to lose your public. And for example, for when you speak about the background of your team, if it's too much people or too much information on the background, maybe it's useful to talk a little bit best about yourself, and it's enough if it's well spoken. But for the rest, congratulations, it's very good.
I would like to add on it. Thank you, Virginia, for reminding me about the team, because as far as you are like making software product, and you mentioned one person as a future CTO advisor who can be a future CTO. It's kind of like tricky thing. You should have a CTO already, and you should mention who is your CTO, so because it's software product and it's important. Yeah.
One sort of just comment around the speed thing is you can be fast for a while and then slow and then things. So I think just think about varying speed, because I think that's the most important thing. I mean, you have to be slow enough that people understand you, but it's more interesting when you change the speed of things. Should we move on to Diana pitching back in 1 minute what you do?
I mean, that's a real challenge. I was writing extremely fast and listening at the same time. So you have to forgive me, but I do my best. So Dana is a digital health solution targeting mental health in pregnant women. The normal flow from a pregnant woman is that she has up to 60 visits with doctors, but there is no mental health check. And research has shown that 90% of pregnant women experience mood disorders and some even mental health issues, whereas 75% goes undiagnosed. Dana is the solution for pregnant women with mental health software. So number one, it does assist and inform the pregnant ladies, but two, also it is a medical device to treat mental health challenges. The IP of Dana is the Motherhood Vitality Index that is able to track pregnant ladies' mood quantitatively. In 2021, Dana was launched by Veronica, the CEO, based on her personal experience, and is so far tested within 30 users. The validation to show product market fit was performed this December, last December. And Dana plans clinical studies for 2022. The first business model is a B2B2C.
That's a minute and a half.
Oh, sorry. Oh, you see, I speak very slowly. Okay.
No, that's that. But yeah, but Sven, did you hear what you expected to hear?
Yes, I heard that some of the message were not clear enough. Yeah, it was pretty interesting. Yeah. And as a big learning, next time I have a Zoom presentation, I'll have the timer in front of me.
Yeah.
So if I know what it is, I can go slowly. And I was totally in the dark.
Yeah,
because you had 1 minute left.
Yeah, and if you know it.
I think there's, I don't have it here because I changed rooms for Wi-Fi, but a couple of things you should have on all Zoom calls. One is a timer separately. The other is a smiley face next to your camera. So you're looking at the camera and at least someone is smiling at you, because when you go into presentation mode, you usually can't see anything. So you're just shouting at nothing, and a little smiley face helps. But the timer is a key one. All right. Last pitch is Alice. Who would like to pitch back for 1 minute?
I don't know once, but I cannot do a try.
Great.
All right.
So all the people who had the positive hat go to negative one.
Positive this time, please.
The negative one go to positive. And we keep the same for new suggestions.
Yeah. Okay.
So we can start. Are you timing it or am I?
I will time it.
Perfect.
Yeah. Can you all see my screen?
Yes.
Yes. Okay.
Oh.
Okay.
Yeah, the one on yellow is bad.
Sorry?
The white on yellow is not clear.
Okay.
Okay.
That's a feedback for later, maybe. Okay, I'll restart that. So my name is Alice, and I'm running a startup that is currently developing the world's first reusable pregnancy test. And despite the pregnancy test being the most commonly used diagnostic tool in the world, it has basically not changed during the last 30 years. And just to exemplify this, to your left, you have a picture of a pregnancy test from the 90s, and on your right, you have a pregnancy test from the 20s. And as you can see, it's basically the exact same test, displaying the results in the same way, using the same technology, but having obvious flaws. So available tests are not 99% accurate as they claim to be, where 50% of the tests sold in Germany, 2014, didn't have the capacity that the package claimed they had. They're also difficult to interpret, where 1 in 4 women have difficulties with interpreting the lines of the traditional pregnancy test. They're expensive per use, costing between 5 to 10 euros, where some women have purchased tests for up to 1,000 euros. They also have a negative impact on the environment, where 900 tons of pregnancy tests ends up in landfill each year, causing environmental degradation. So this problem, we at Pharmista Technologies intend to have a solution to by developing a pregnancy test that is reusable. And our test will be an improved diagnostic tool, as we will employ a whole new technology. It will be easier to interpret, as the results will be displayed on a digital reader instead of in the form of 1 or 2 lines. It will be affordable and also environmentally friendly, since the materials will be sustainably sourced. Lastly, it will increase convenience and decrease stress, as a test will always be within reach whenever the woman is in need of testing. 90% of women of over 500 are interested in replacing today's solutions with our reusable one, highlighting the fact that this is a very much needed product. The customer suffers from infertility. She has tried to become pregnant for at least 6 months, often up to a year. And she often lives in bigger cities due to it's more of a common fact that women living in bigger cities tend to become pregnant later in life, where infertility and age has a correlation. And this is a quote from an interview I had with a woman suffering from infertility. She claims that you kind of become a test addict when you want to become pregnant so bad. It's hard to refrain from testing all the time, since you hope that one day you will get a plus on a pregnancy test. The product itself, we will price it at 50 euros, which it will include 10 strips. If the woman is in need of testing more, she can purchase refillable strips priced at 2.5 euros per strip. And the business model will be based on the razor and blades model, being one of the most successful revenue models in history. The market is expected to reach a 2.1 billion euro evaluation in 2025, where we plan to target the infertility market at first, where our goal is to target 30% of the European market, amounting to a revenue stream of almost 20 million euros, and 75% of the Scandinavian market, amounting to around 4.5 million euros in revenue, thus amounting to a total of 24 million in revenue in 5 years' time. The team behind this is myself, and I have a master's degree in sustainability and leadership. And I have also experience in business development within the biotech sector. With me, I have my co-founder, Robert. He has a PhD in chemistry and an area of expertise within developing immunoassay technologies. He's also founded over 5 companies and made 4 exits. And then we have an experienced advisory board with us, Christina and Mohammed, having many years of experience within the field and also having PhDs within the area. So if you want to contact me and hear more about what we're up to, then please feel free to do so. And I would like to thank you for your time. I have no idea how I did on time, but yes.
Okay. You had 30 seconds left.
Okay.
All right. Sven, do you want to pitch back in 1 minute?
I have to find you. It's because it's the you're still sharing the screen.
Yes.
Okay, let's go. Hello, I just saw Alice, which is the founder of Farmista. Farmista is working on pregnancy tests. Did you know that the pregnancy test didn't change in the last 30 years? What we saw in our investigation is that almost 50% of all the tests are not accurate. They are difficult to interpret, expensive, and also have a negative impact on the environment. The solution is to work on a reusable pregnancy test, which is easier to interpret, affordable, environmental friendly. Objective, increase in convenience and diminish the stress. The users we talked to, over 90% are interested in the solution. Our customer is a woman which is suffering from infertility, tried to become pregnant for at least 6 months and lives in different cities. We are going to market the solution to 50 euros for 10 strips, 2.5 euro if it is refillable, and we're following the razor and blades model. The market is huge, over 2.1 billion euro in 2025, and our objective is to reach 24 million in 4 years. Our team is packed with serious entrepreneur and a lot of high academics with a lot of, I don't remember the last word, but it's a great team and you have to believe in us. Please invest in our company. 1 minute?
1 minute 20, but that's okay. Any surprises there, Alice?
No, I think it was actually everything that I intended to say. You kind of captured. So I'm very pleased that the message came across.
All right.
Thank you. And it was very innovative to do a full-on pitch back. So it was fun to hear.
Good. Positive people.
Well, I'm on the positive side now. So I agree with Sven that you have a very strong team, very professional, like well-packed, and like ready to launch a product. And the market is huge and quite universal. So the problem is the same everywhere in the world. And I think you can reach like a big potential with it. The only one thing I didn't understand, like you said that you are launching 2025. It's like quite far away, or maybe I misunderstood when I launching your product actually. And also, you know very well that you focus target audience and their needs, and you made a lot of research. And you ask women, and you make customer development, obviously. But the only one thing though is missing out, to my mind, is like a huge audience of girls who made the pregnancy test because they don't want to be pregnant. And in this case, they don't want to have 10 tests. They just make it once when they're afraid or something, and then they don't want to have 9 for the future. So I don't know if you are going to serve this audience too, or only those who make a lot of tests. So like a little bit like question about like 10 pack. Do you need all of them?
Okay. Thanks.
Should I answer or no? No.
Just keep going. Who else has something positive?
I have the positive head as well. And first of all, you come across as a very skilled person. I instantly trust you, and I really liked your presentation and how you presented not only your idea but also yourself, and you had the right pace. So this was very convincing. I like that you showed you compared your product and the status quo on the same page, so you could follow easily. And I also like that you showed an emotional quote of the interviews you did. Thank you so much.
What was not so good?
If I have to be negative, first of all, it was good, but my task is to be negative. So I miss 2 things. One, how do you do it? I mean, I know that it's very good, it's better, but how do you do it? What's the principle behind the product? It hasn't been mentioned, that's one. And the other thing is, how did you prove that it's good, that it's working, that it's efficient? These 2 things were missing. I think I didn't find them. But all the rest, the way you did it was very good. I mean.
Thank you.
Thanks. So who had the other negative ads?
I didn't have any hat, but I have one thing to say, if I can.
Sure.
As I've been on that journey recently, well, my baby is now 5 months, so a couple of years, half and 1.5 years ago, I was wondering, I would definitely have bought your test for sure. And I was wondering, is there really no competitor? Because when I was on that journey, I didn't think that far. I was just trying not to do so many tests and just wait. But is there nothing else?
There is one test that is, you can insert 3 strips in it, which I also bought just to check the quality of it. And like, I think it was 2 times or 1 time, it didn't really connect well. It didn't read out the way it was intended to. And you couldn't buy these refillable ones, which is a really core part of our business idea, that you should be able to refill the monitor with new stripes. So yeah.
And then from the technology part of, I completely agree with what was said, that I would like to know how it works from a scientific point of view, but probably the investors or customers are not so interested. But how long does it last? I mean, is that, are you designing it for one cycle of women trying to get pregnant, or does it last 5 years? Or
yeah, good question. So the product isn't really developed yet. We're still in the phase of proving the principle and developing a prototype. But the technology or the binding method we're using is or has a shelf life of 5 years or more. So that means that our product will most likely have a shelf life of the same amount of years. So the goal is to really develop a product that is as long lasting as possible. But now we don't really know how long it's gonna last.
Okay. And just one last thing from an investment point of view. I don't know if you had that, but maybe I can send you an email as well, because I would be interested to learn more from what you're looking for funding wise.
Yeah, great. I'll post my email in the chat as well. Yeah.
Okay, thank you. So the last 2 people who had the ideas had?
First of all, I don't know, I'm one of the ideas had, but I don't know if you mentioned it, and I'm sorry if I lose the information. Is it qualitative, quantitative result, or only qualitative? I mean,
in what way do you mean?
I mean that you show numbers, or only positive, negative?
Positive, negative.
Okay. No, I'm just asking this because from doctor point of view, for example, if one day you pitch for a doctor, it will make difference for them to know that. So you are prepared for this question, just to prepare you.
Yeah.
And so what else? It's just a comment, nothing relate, nothing urgent, but be careful a little bit with the colors, that you put light color with light color, and sometimes you can't read.
Yeah.
And a big square with a lot of information in a quick slide that people can focus very well. So, but it was very good. It was very good. Congratulations for the rest.
Thank you. Thank you. And you meant the one where I talked about the revenue.
Exactly.
Yeah.
Exactly.
Yes. Thank you.
Tenya, do you want to propose some ideas of improvement?
No, I think it's okay. Yeah, it was really good, especially as I understand your project is on an early stage. Colors were already mentioned. I really like that you had this personal touch, that, there was this kind of infographic, not infographics, how you call it, a little picture with different women, on the first slide. You're going into a very competitive market, and I would just advise you to keep in mind an exit strategy. And you have the 4 exits guys on your team, so that's great because it might be the way to go. Yeah.
Yeah, definitely. Thank you.
Maybe just one from my side was marvelous and also got involved directly. But the question that were in my mind is, what is your roadmap? What is the next step, and how are you going to go to the scalable production model? Partnerships, with who are you working? Where do you say, oh, wow, besides people, is it like an institution? And I also had the barriers of competition. Okay, but the actual providers, what would they prevent them to do the same quickly? like refillable strips, even if it's not 100% accuracy.
Yeah, do you have a patent or something like that that could reassure investors?
Yeah, that could be good to mention. We filed a patent in July this year. We haven't gotten any feedback on it yet, but that could be something to mention, that we have a patent pending or something.
I think it's good to mention that it reassures a lot the investors to know that it's somehow protected and it won't be copied in 2 seconds.
Yeah, definitely.
Okay, great. I think did we lose Doug?
No,
again?
I'm here. I'm back with my Wi-Fi.
You're so quiet.
I'm not sure if that's a good or bad thing. If I'm quiet for 5 minutes, you think I've gone.
No, it's fine. It's fine.
No, but yes, I'm back. But and thanks for that. And I think just sort of one comment on that. And I think what's interesting is when we spoke at the beginning, we spoke about salespeople and who do we like. And it was about empathy and trust and vision. And I think it's interesting because when Alice pitched a vision with almost nothing else, and everyone wanted to buy it, which I think is an interesting message for us all, and to think about how the sales process works. Like, everyone wants to support it, even if you've got these questions and things. And I think that's one thing to think about as you pitch, is sort of that vision and getting people to want to help. And that I think, regardless of the pitch, whether it's to investors or for partners or anything else, I think having people leave it and go, I really like them, I want to help, is I think a good goal to have when pitching.
Yeah, and I can add to that all the pitches that we got, I think it's so important that we felt that you are passionate about your own project, and that's a big strength to keep. And even though you probably pitched like 1,000 times already, it's for us it looked like you were really into the pitches. So I think it's also something to keep in mind, that even if for you it's like the 100th time, for us who are listening to you, maybe it's the first time, so it's all new. So we need to feel your excitement, like it's all new again. But I think that was well transmitted. Right.
Late on a Friday, I'd just like to keep you for just a few more minutes. Is just some feedback on this session and the focus groups in general. What did you like, and what do you think we could do better in the focus groups in general? So we've had 4 sessions, and you may have been in other sessions. What's good about this, and what would you improve? We can have a few moments of reflection and just put it directly in the chat, and we'll give you 2 minutes to write in the chat, and we'll see what comes out there.
Is it possible maybe to say it, or should we write?
If you just write it in the chat, and then more than one person can type at the same time in the chat. Whereas if you say it, then it's not.
Well, I would say for me it's easier to say if it still works, but because I start writing and then I start thinking and write more, and it's like never ending process,
Okay, then
so,
then share.
Yeah.
Share. Go ahead.
Okay. I'll be quick. I just mean that I was participating in all sessions, I think, and for me, like, it's every time it's surprised what will be in the session, because sometimes we work on Motherboard, sometimes we're pitching, sometimes we're just exchanging opinions and giving feedback. And I like it, like it's kind of like surprise moment, but I would like to know beforehand, because if it's a pitching session, maybe I was prepared to pitch, or if it's like we share opinion about some other presentation, I would prepare on the topic or something like that. So I would like to know more a little bit beforehand when I join, what will be there. And what I like is like quality of people who participate. They're really professionals in their field. and very nice opinions, and it's very valuable, like the information that you get in this session. So thank you for this, for gathering us.
Thanks.
Okay, thank you.
Yeah, I think that's good. That's good feedback, and I think we sort of sometimes we give homework and no one does it, and then sometimes, you know. So, but I think you're right. What we should do is respect lots of different styles, and have some information. And if 3 people read it, then 3 people read it. Then they'll be prepared. I think we should be more like that. So that's good. Thank you for that. Great. Laura, would you like to finish off, or perhaps Ksenia as the host will finish off?
Our host, invited special guest.
Is there some protocol to follow, or I don't know, just like, I don't know. Just some concluding remarks, something like that.
Yeah.
Okay. Well, first of all, it was thanks for having me. It was really great. I'm sorry that it was not possible, unfortunately, for me to join all the focus groups and all the sessions, but I think you guys did a great work, and I did attend 1 or 2 other sessions of yours, not fully, but at least some parts. And you know, Doug, you mentioned in one of your emails that you believe that you didn't manage to create a community, and I would like to challenge you on that point. I think you're underestimating yourself, because if we're looked at Anna, for example, who attended almost all of the sessions, and I can feel that you guys are here. You're not here necessarily for the first time, and I think you did great work, you and Laura. And I also want to thank all the companies that pitched here today. It was really, really cool to hear your pitches. They were very different, very interesting, very cool products. If some of you want to join Tech4Eva program next year, please apply. And you know, if you want to connect with me offline, I'm also always very happy to talk to all of you. And on that, I'm going to wish you a wonderful weekend and go to the daycare to pick my daughter.
All right.
Thank you very much. Yes, you are right on time.
Everyone.
Thank you. Happy weekend. Bye-bye.
Thanks,
Bye.
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 Thanks. Bye.